Right, so we saw that the job of your plumbing, the job of blood is to carry oxygen and nutrients to cells and get carbon dioxide from the cells. Okay, so what we learned last time was this is done at the capillary level. Okay, and a capillary is about 1 millimeter long. So you guys might have seen 1 millimeter is about that much, 1 millimeter long. And there's a capillary every capillary is catering to 4 to 5 cells. Okay, so the human body has 10 billion capillaries, giving a capillary every few cells on the average. Okay. Now, one of the problems we had to solve was we saw that blood coming out of the heart is going at about 30 centimeters a second. Okay, so about 30 centimeters per second. That's a foot a second. Now, if the blood flowed at that speed in the capillaries, that would be too fast and it couldn't exchange all the stuff it needed to exchange via diffusion. So you had to slow the blood down quite a bit. Okay, and we'll see that soon. We've already mentioned this. The blood is flowing at about so blood is flowing at about 0.2 or 0.3 millimeters per second. It's flowing at 0.2 millimeters a second. I'm writing it as 0.3 millimeters a second just to show you. 0.3 millimeters a second, which is 0.03 centimeters per second. Okay, so what you're doing is you're slowing it down 1, 2, 3, 1,000 times a second. Okay, so when the blood is coming out of the heart, it's going at 30 centimeters a second. When it comes to the capillaries, it's slowed down by a factor of 1,000. Okay, and so what this does is, so it's actually 0.2 millimeters a second. We'll do the numbers. So the time the blood spends in the capillary is the length of the capillary, which is 1 millimeter, divided by the speed in the capillaries, 0.2 millimeters per second, 5 seconds. Okay, so you've slowed the blood down in capillaries such that it's spending about 5 seconds there, and so you have enough time for diffusion to do its job. Okay. Now the question is, how do you slow it down by a factor of 1,000? And that's the continuity equation. Okay, so these major blood vessels branch into capillaries, and what this equation is telling you is, okay, this is the flow rate. The flow rate is the speed times the area of cross section of the vessel. Okay, so flow rate is area of cross section times the speed at that level. And if you want to slow blood down, you have to somehow increase the area, V2, A2. Okay, so if you increase the area by a factor of 1,000, the blood will slow down by a factor of 1,000. Okay, and if you add up all the areas of cross section of the capillaries, that's 1,000 times greater, and that's how blood slows down by a factor of 1,000. Okay, and this, we saw a table a few slides ago. You see the total cross section of the aorta, the big blood vessel coming out of the heart, is 3 centimeters square, and the total area of all the capillaries cross section is 4,000 centimeters square. So a little over 1,000 factor. Okay, so the area of cross section increases by a factor of 1,000, and the area increases by a factor of 1,000, and the blood slows down by a factor of 1,000. Okay. So that's how the body solves that problem. Yeah. All right, so this goes through the numbers. So on the average, you're pumping blood at 5 liters per minute through your body. Okay, and so there's 5 liters per minute. This is converted into seconds, into meter cube per second. It's that many meters cubed per second, so you can stand at any point in your body. and the amount of blood flowing across that area is that much. Okay, and so the area of cross section of the aorta, the diameter is 2 centimeters, just a little less than an inch, and so they're calculating the average speed of the blood flowing out of the aorta is 0.26 meters per second. Okay, so that's the average speed, about 0.3 meters per second. So that's 30 centimeters a second. You know. And then you saw that we just saw a second ago that the area of cross section of all the capillaries adds up to 4,000 centimeters square. Okay. And so if you calculate the speed of the blood through the capillaries, it's the flow rate divided by the area. There's the flow rate we had calculated, okay, from 5 liters a minute, divided by the area. That gives you that much. That's 0.2 millimeters a second. And this is about 10 to the minus 3 meters is a millimeter. So this is 0.21 millimeters per second. Okay. And so here's the time blood is spending on the capillaries. It's 1 millimeter divided by the speed, and this is all converted to meters, okay, by the speed. So blood spends 5 seconds in the capillaries. Okay, that's what the calculation shows you. Okay. So allows enough time, 5 seconds, for diffusion to take place. Okay. So your body understands physics well, okay, so, and it uses it to its advantage. Okay. All right, here's another thing that the body does. Okay. The capillary size is very interesting. It's just so that you see these blood vessels, red blood vessels, go through its single file. Okay. What this does is it reduces the friction. It reduces the viscosity of blood by going through single file. And what does that mean? If it reduces viscosity, the pressure difference has to be less. It's easier to pump blood through the capillaries. So if this were too large, and let's say if it were too large and let's say maybe 1.5 red blood cells could fit, then it would take a higher pressure to pump blood through the capillaries. So the body improves its efficiency by the size of the capillaries. Here's another thing it does. Because the red blood cells are barely fitting in, now diffusion also happens easily. Okay, the cells are close to the walls, and diffusion, the diffusion distance also is decreased. Okay, so the capillaries are about as small as they can be because the red blood cells barely fit through. They flow single files. They even deform to the contours. This puts the cells close to the walls of the capillary, which enhances diffusion. Okay. So now the diffusion distance is decreasing. It also reduces the viscosity of the blood, so reduces the pressure needed to move the blood through the vessels. Okay. So everything is designed properly. Okay. Everything is designed to increase efficiency. Here's a normal, healthy blood pressure. Okay, so this is the blood pressure. So when the left ventricle contracts, okay, that's the blood pressure in the aorta, 120 millimeters of mercury, and that's a gauge pressure. The gauge pressure meaning that's actual pressure minus atmospheric pressure. And between heartbeats, the pressure in the aorta is 80 millimeters of mercury. Okay, so that's what this blood pressure is. So at compression, it's 120 millimeters of mercury, and between compressions, it's 80 millimeters of mercury. So that's the pressure in a healthy person. Okay? And if the pressures are different than this, then that means there's some problem. Okay? And that's why doctors measure pressure. That's the first thing they do, measure pressure when you go to a doctor. Okay, so and this pressure, okay, so this is called the systolic pressure, and this is the diastolic pressure. Okay, the diastolic pressure is, so when the heart pumps blood, the blood vessels expand to accommodate excess blood. And then after the blood is flown, when the blood vessel compresses back, that's what's maintaining that 80 millimeters of mercury pressure. Okay. So this is for a healthy young adult, 120 over 80 millimeters of mercury. Again, this is a gauge pressure. The diastolic pressure, which is 80 millimeters, is due to the elasticity of the arteries. Okay. All right. Now here is a table that's showing you pressures in the human body. Again, this is a table from another textbook. Okay. So the systolic pressure, the maximum pressure in a healthy adult is between 100 to 140 millimeters of mercury. In an infant, it's 60 to 70 millimeters of mercury. All right, you see in the infant, it's almost half. Why do you think that is? Okay, so the flow rate, so here's sort of a partial reason. R to the power 4 delta P over L over 8 eta. Okay, so this is the viscosity of the blood. The viscosity of the blood doesn't change between an adult and an infant. Okay, the length of the arteries of the blood vessels is smaller in a young infant, and so you don't need as great a pressure. Okay. So the pressure is that, and again, these are all gauge pressures. The diastolic pressure is 60 to 90 in adult and 30 to 40 in infants. At the veins, it's between 4 to 8 millimeters of mercury. The capillary blood pressure at the arterial end, it's 35 millimeters of mercury. At the venule end, it's 15 millimeters of mercury. And there's a diagram here that summarizes all of that. See, this diagram shows all that. Okay, so 120 millimeters at the arterial end of the capillaries, it's 35 millimeters. At the venule end, it's 15 millimeters. And in the large vein, it's 4 millimeters of mercury, and so on. Okay. Now you see, now here's a question. In your large veins, in your legs, for instance, as the blood is coming back to the heart, this pressure is too low to bring it back to the heart. So what you need is, you need additional help. You need extra pumps. Okay? And there are extra pumps in your legs to help bring the blood back to the heart. Okay. By the way, there are other pressures here. Your eyeballs are kept spherical. So this is your pressure inside your eyeballs, about 15 millimeters of mercury. Again, this is gauge pressure, and so on. All right, so we'll come to how the blood is brought back to the heart in a second, but let's talk about how the blood pressure is measured. Okay, so I said the blood pressure, the blood pressure there at your heart is 120 millimeters of mercury. Okay, but that's not where the blood pressure is measured. What they do is they measure the blood pressure in this brachial artery. All right, so the reason being, when the blood comes from the heart to there, it's going through a big pipe, and the blood pressure does not drop much in flowing through the big pipe. So as long as you measure the pressure here at the same level as the heart, you're getting the pressure at the heart. So that's what's happening. Okay? And here's how the blood pressure is measured. Okay, when the heart compresses, when the left ventricle compresses, the blood pressure here is about 120 millimeters of mercury in this blood vessel. And so what do they do? So they put a cuff around there, around your arm. And if you increase the pressure on your arm to greater than 120 millimeters of mercury, then this blood vessel will collapse. It'll totally close. So what they do is they're starting to measure the pressure, they'll increase the pressure here to, let's say, 150 millimeters of mercury. The blood vessel has collapsed, and then they slowly release this pressure. When this pressure decreases to the maximum blood pressure in your blood, now the blood vessel starts opening. And blood squirts through this blood vessel. And that flow is turbulent. And you can hear that in a stethoscope. So when you first start hearing the flow of blood, that gives you the systolic pressure. Then you keep reducing the pressure on the cuff. Okay, the blood vessel is still constricted, and so it's still turbulent flow. And when you reduce the pressure on the cuff to the minimum pressure here, the blood vessel is completely open. When the blood vessel is completely open, the flow is nice and smooth, it's laminar. It's no longer turbulent. And you can hear that in the stethoscope. When all the noise goes away, that's how you get the diastolic pressure. Okay, did you guys understand that? All right, so that's how blood pressure is measured. Okay, so that's what this says. So the transition is easily heard in the stethoscope. Okay. What this shows you is, okay, so we said the blood pressure drop from the heart to there is very little. So the blood pressure, the blood pressure in your arm is proxy for the blood pressure in the heart. And the claim was the blood pressure drop is very minimal. Okay, so in that problem that I'll go over, we'll show that the blood pressure drop in 20 centimeters, 2/3 of a foot of the brachial artery, is only 1 millimeters of mercury. That's what the problem will show you. Okay. So here's so a woman is lying down with her arms horizontal along her upper arm. Her brachial artery stretches 20 centimeters. So this artery stretches about 20 centimeters. Okay. And the blood is flowing at 9 centimeters per second in the brachial artery. How do you measure that? How would you measure that? You guys, how would you measure the speed in artery? That's what an echocardiogram can do. Okay, a sonogram can measure that. Okay, so echocardiogram. So you measure that like that. Okay, so now we're going to calculate the blood pressure drop in the brachial artery. Okay, and that's what this is. Okay, and it's 8 at of average speed times the length of the artery divided by radius square. And the brachial artery is has a radius of 2 millimeter radius. Okay, 2 millimeters is that much, so it's about half a centimeter. 1/5 of an inch is the diameter. Okay, so you put those numbers. There's the viscosity of blood. There's 8. There's the speed. There's the length 20 meters, and there's the speed 0.09 meters per second, and there's the radius squared. And you see, this turns out to be 1 millimeter of mercury. Okay, so what this is saying is the blood pressure drop across the brachial artery is only 1 millimeter of mercury. So you could have probably another millimeter loss up to the heart. So when you measure the pressure here, that is the pressure at the heart. Okay, give or take a couple of millimeters of mercury. Okay, now how does the blood pressure change with height? So if you're, and this is a calculation for big arteries, big blood vessels. So if you put the cuff here instead of at the heart level there, okay, so when you measure the blood pressure, you're measuring at the heart level, but if you stand up and let's say you put the cuff lower, if you put 6 inches below the heart, here's what happens. Okay, what this shows is The blood pressure difference is the density of the blood, and this is the hydrostatic pressure. The pressure difference between height, and that's acceleration due to gravity, and that's the distance. For 6 inches, 6 inches, which is about half a foot, the blood pressure drop is 12 millimeters of mercury. Okay, so if you go to a doctor's office, you're standing and they measure the blood pressure, they put the cuffs not at the heart level, but let's say higher on the arm, 3 inches higher on your arm, the reading will be off by 6 millimeters. That's what that is saying. Okay, so for every 6 inches in height, your blood pressure drops by 12 millimeters of mercury. Okay? So what does that mean? So your brain is about a foot higher than your heart. The blood pressure at the end of the jugular vein is about 24 millimeters of mercury less than at the heart. Okay? So that's what this problem is saying. Okay? All right, so animals like this have to deal with this. So their heart is over there. The blood loses a lot of pressure getting there. So consequently, the heart of this animal of a giraffe has to be much stronger, and the pressure it has to maintain here is quite high, and the pressure the pressures in a giraffe are 240 to 160 millimeters of mercury. Okay, systolic pressure is 240, twice our pressure, and the diastolic pressure is also twice us. Okay, so so blood pressure decreases with increasing height above the heart. When you're upright, the blood pressure in your brain is noticeably lower than the pressure at your heart. For animals with long necks, this difference in pressure is correspondingly greater. Okay? So a giraffe's head can be 2 meters above its heart. 2 meters is roughly, 2 meters is 6 feet 9 inches. Okay? So almost as tall as a tall person. All right, now let's come to the veins. Okay, so you pump, blood has gone to your legs, and you see the pressure difference is very small, so 15 to 44 millimeters of mercury. How do you pump the blood back to the heart? Okay, you need additional help, and the additional help comes in your legs. Okay, so these are the veins in your legs. Okay, and your calf muscles, okay, help you pump that blood back to the heart, okay, from the legs. So your veins in your legs have one-way valves. So when the calf muscles contract, they pump this blood upward toward the heart, and when they relax back, this valve closes, so the blood keeps going up. Okay, so here is an additional pump. Okay, that helps bring the blood back to the heart. Okay. So people are rarely completely relaxed, even when sitting quietly. Small motions such as shifting in a seat or tensing aid circulation with muscle pump. Okay. So no matter what you're doing, you're always moving a little, and so those muscles contract and help the blood return to the heart. Okay. If you sit or stand for a long time, this system cannot do its job, and blood can collect in your legs. Okay, so at some point you'll want to get up and move around using your leg muscles to push the blood back toward your heart. That's why some of your smartwatches will remind you to stand up and walk around every hour. Okay, so that's why those do that. Okay. In people that are completely motionless, such as soldiers at attention, the return of blood to the heart is slow enough that they may faint. Okay. So have you experienced that? Or seen it? Oh, yeah?
Okay.
Where at?
Attention.
I'm sorry?
I said attention, information. Watch people lose their teeth.
Oh, yeah? All right.
Don't lock your legs.
what do these guys do? They don't have muscles in their legs. So what they have is have a bunch of blood vessels under their hoofs. And so when they walk, that acts as pumps. Okay? So when you put a shoe on the horse, that inhibits circulation. Okay? So a horse has no muscles in its lower leg that aid its blood return to the heart. Instead, the normal force of the ground compresses a network of veins in the hoofs, pushing blood upwards to where the valves in the vein prevent return of blood. So, and then when a horse walks, the changing forces on each hoof makes the system work like a pump. Okay. So why does your body have all this? If your body didn't have, if the nature didn't have all these mechanisms, your heart would have to be much stronger. Okay. And you don't want to do that. So that's what you're doing. It's the distribution of labor. Okay. Okay, now we'll calculate the pressure involved in intravenous transfusion. Okay. So when you're getting an intravenous transfusion, the question is how high should the bag be? Okay. So that's what we'll calculate. If the bag is higher, what will happen? I'm sorry? The flow rate will be higher. If it's lower, the flow rate will be lower. Okay? So the height determines the flow rate. Okay? Yes, so if this is too low, so I don't know if you heard her comment, if this bag is too low, okay, the blood in the veins is at 10 millimeters of mercury. So if the pressure here is less than 10 millimeters of mercury, then the blood will go into the bag. That's not good either. Okay. So what you want is, okay, so the total pressure at this point, the pressure at this point needs to be greater than 10 millimeters of mercury to push the fluid. Okay. So, so this problem goes through the calculation, and I'll do the numbers. Okay. So suppose 1 liter of saline solution with the density of, this is the density of saline solution and viscosity, is to be infused in a patient in 8 hours. So you're giving saline, 1 liter of saline, this bottle here is a liter. You're going to give that much saline in 8 hours. Okay. So we'll first calculate the flow rate, and we'll calculate the pressure difference you have to have across the needle. Okay. So that's what the problem, so the flow rate is 1 liter in 8 hours. Okay. And that flow rate is converted into SI units, meter cube per second. Okay. Again, you don't have to, you just have to have a sense for these numbers. So Poiseuille's equation, so there's the flow rate. Okay, so the pressure difference you have to maintain, and thus the pressure difference needed between the ends of the catheter tube, okay, is 5,760 pascals. Okay, so between the ends of this tube, you have to have 5,800, 6,000 pascals. Okay, the pressure in your veins is 10 millimeters of mercury. Okay, and 10 millimeters of mercury converted to pascals is 1,300 pascals. Okay, so the pressure is this is the gauge pressure. The pressure is, thus the pressure on the fluid side of the catheter must be 7,000 pascals. Okay, so there's the catheter. Here you want 7,000 pascal to push that liquid at that rate. Okay, and so to have that pressure, this is coming from the hydrostatic pressure, this height of the liquid. And so we'll calculate the height of this liquid now. Okay, so to get that pressure is rho g, the height of the fluid, the height of this bag above the catheter level. Okay, and that's what that calculation is. So that height is that pressure, 7,000 pascal, divided by the density of fluid, divided by gravity, and that's 0.7 meters. That's a little over 2 feet. It's 2.5 feet. Okay, so that bag is 2.5 feet above the catheter. Okay, so that's, and if you raise it a little more, then you're giving the fluid at a faster rate, and if you're lowering it, the fluid is going at a less rate. Okay, and this can be important if that the IV has medication as well, so that determines the rate at which you're giving medication as well. All right, so you saw that in big blood vessels, pressure decreases with height and increases with decreases with height and increases as you go below the heart level. Okay, and this formula tells you how much the pressure increases or decreases. Okay, so about for every 6 inches you saw, how much does the pressure change? 12 millimeters of mercury. Okay, so in the circulatory system, it's convenient to measure height of the fluid relative to the heart. Okay? The pressure drop due to resistance is negligibly small in major arteries. Okay? If pressure in major arteries in the head drops too low, the person can potentially faint. Okay? Okay, now we'll talk about flow regulation. Okay, so here's flow, and I'll write down the formula. So what in this formula, this is flow, that's the pressure difference between the ends of the tube, and that's the resistance of the tube. Okay, and the resistance of the tube is that. So I'll combine the two formulas, and you've seen this formula, pi r to the power 4, and now this r is the radius of the tube. Okay, delta P, the pressure difference, divided by L. Okay, 8. Okay, that is the viscosity of the blood. Again, you're not changing that. So if you want to increase flow rate, okay, let's say you go for a run and you want to increase flow rate because you want to supply oxygen faster to your cells. If you want to increase flow rate, what you can do is you can increase the pressure. Okay, that means your heart is having to work harder, or you can dilate your blood vessels, make them wider, and you can increase flow rate. So the difference between a good athlete and a bad athlete like me is I increase my blood flow rate by increasing the pressure. A good athlete increases the flow rate by increasing the diameter of the. Okay. So they don't rely on increasing the pressure that much. Okay. So the body has considerable latitude in blood flow regulation. Blood flow to individual organs and total flow through the body can be varied. So if you go for a run, what happens? Your heart rate goes up, and that's how you're increasing your blood flow rate. Okay. Blood flow is adjusted both by changes in vessel radii and by changes in blood pressure. Okay. So good athletes minimize changes in blood pressure and maximize vessel radius increase. Okay. Okay, so it's not surprising the body adjusts flow by changing vessel radii. So if you change the vessel radii by just a small amount, you can increase the flow rate. Okay. Most vessel dilation, vasodilation, and constriction take place in small arteries and arterioles. Okay, so in the smaller blood vessels. Drugs can also induce vasodilation or vasoconstriction. So for example, a local anesthetic may be administered with a vasoconstriction. Why would you do that? So if the blood flow is not, so if you want to give a local anesthesia in a jaw during oral surgery or whatever, if you constrict blood vessels, blood is not flowing as much and it's not washing away, transporting away the medication. Okay? To reduce blood flow and prolong the time the anesthetic remains in place. Okay, okay, so during strenuous exercise, flow may quadruple. Look at this. So during strenuous exercise, pi r to the power 4, 8 eta. Okay, so you want to quadruple blood flow during strenuous exercise. Well, you can quadruple the blood pressure, so your heart pressure would be 480 millimeters of mercury if you just try to take care of it with your pressure. You don't want to do that. What's wrong with increasing the pressure too much? If you have an aneurysm or someplace, that'll burst. All your capillaries would become leaky. Yeah. So how do you solve that problem? You have to increase the radius of the blood. You have to have vasodilation. During strenuous exercise, the blood flow may quadruple with a 50% increase in arterial blood pressure. So your blood pressure can go from 120 to 180 millimeters of mercury. And significant vasodilation. So vasodilation by the radius would increase by 30%. Okay. Athletic conditioning makes vasodilation more effective, and blood pressure increase need not be as great. Okay, so that's what all this training is about. You train your body for increased vasodilation. So high blood pressure can be dangerous. It can rupture vessel walls, causing a stroke or a heart attack. Okay. Furthermore, the heart must exert more force to create high blood pressure and is strained. High blood pressure often occurs with aging and may be designed to maintain flow in vessels narrowed by plaque. Okay. So as we get older, as your blood vessels get narrower, your blood pressure has to increase. Okay, so in our blood vessels, what you want is laminar flow. You don't want turbulent flow. Why don't you want turbulent flow? If you have turbulent flow, it takes more effort to maintain a certain flow rate. Okay, when you have laminar flow, you don't, and the flow rate is maintained easily. Okay, so you'll have laminar flow as long as when the fluid is flowing in a tube. You'll have laminar flow as long as the Reynolds number is less than 2,000. Okay, so you will have laminar flow if the Reynolds number is under 2,000. Okay. So this shows you a calculation for blood flow in your aorta. Okay, so but it's too far below threshold for with the numbers we have now for the aorta, we can calculate the Reynolds number. So for aorta, there's the density of blood, there's the speed of the blood coming out of your heart, average speed, okay, and there's the diameter of the aorta, and there's the viscosity of the blood. So the Reynolds number for the blood coming out of your heart is 1600, and you can see that it's below the Reynolds number, so it's laminar and not chaotic. Okay. If you increase the speed of the blood, that number could go about 2000, or if you increase the speed, it could go about 2000 and become chaotic. Okay. How could you increase the speed? If plaque narrows, if the plaque narrows the blood flow, then the speed can increase. Okay. If there's narrowing in large artery, speed increases and puts Reynolds number above critical value, leading to turbulent flow. Okay. Turbulent flow can be detected from the sound it makes. Okay. This is one thing a physician is screening for when listening to your heart. The sound of turbulent flow is a sign of trouble. Okay, so that's what they're listening to you. And even when they listen to your lungs, what they're listening for is they don't want airflow being turbulent to your lungs. So that's what they do when they put the stethoscope on your back. They're listening to your lungs. Okay. Turbulence can be detected by the sound it makes. For example, the noise that a water faucet makes is the sound of turbulent flow around its valve. Turbulence in heart, major arteries, and veins is easily detected by a stethoscope, so you can easily hear it. normal heart sounds are caused mostly by valves closing. Okay. Flows through a leaky valve is turbulent. Since it's partially closed, valve form an irregular obstruction. Okay, so leaky valves, the flow is turbulent around leaky valves, and you can hear that. Sounds may be by leaking heart valves can be heard as are called heart murmur. So when they hear heart murmur, that's a sign of leaky valves. A hole between heart chambers is another cause for turbulent flow. So when a lot of infants, when they're born, there's a hole between the chambers of their heart. Okay? Such a hole exists in normal newborn infants and normally closes within a few hours after birth. Okay? An aneurysm is a ballooning of blood vessels due to weakened walls. The irregular shape of an aneurysm can cause turbulence. Okay, so you don't want high blood pressure if you have an aneurysm, it can burst. Okay? Aneurysms are quite dangerous. If one bursts, stroke, heart failure, or severe hemorrhaging is the result and often fatal. Okay. All right, guys, so that finishes this chapter.